Okay, thank you for the introduction and the opportunity to present you the development of guidelines for long-term care facilities, specifically for nursing homes. That's the outline of my presentation. The first question will be why focus on nursing homes? Secondly, why do we need specific guidelines for these institutions? And thirdly, I'm going to discuss how developed these guidelines, what updates we did with some examples, and then the dissemination of these. So first of all, why focus on antibiotic use in nursing homes? We have data showing that a lot of residents, actually up to 70% of them, are exposed to antibiotics each year, and maybe half of these antibiotic prescriptions might be inappropriate. At the same time, on the resistance side, we have data showing that if we take the same age group in nursing homes and in the community, the bacteria that we isolate in nursing homes tend to be more resistant. Even the nursing home residence is now included in some clinical decisional algorithms in the emergency department when we need to start to make a decision about an empirical treatment. And over time we have resistance growing, and I'm going to show you some local data after too. We also have age, so it's an aging population, and we know that the age is a risk factor for Clostridioides difficile infection, which might be a consequence of high antibiotics exposure in this setting. So here are some local antibiotic consumption data from Canton de Vaud. We have an ongoing surveillance going on since 2014, and as you can see, we have antibiotic consumption that remains constant over time, and if you look closely, you will see that we have a lot of heterogeneity and a lot of variability between institutions, even between institutions that host the same type of residents or have the same mission. And as Domenica showed, we also have regional differences. For example, we have almost 3 times the antibiotic consumption in the French-speaking Switzerland, although the prevalence of highs were quite similar. We have some local data on resistance too. We know that for some types of resistance we have an increasing trend over time. For example, for ESBL, passing from 5 to 52% over 10 years. And some data from Canton de Vaud using another methodology. These are clinical data. We have ESBLs ranging from 8 to 15%, and we have seen that the use of certain antibiotics like cephalosporins is associated with the development of this resistance. So in conclusion, we have a setting where we have a lot of antibiotic consumption, a lot of inappropriate prescriptions, and a highly vulnerable population which is prone to side effects and the emergence of resistance. So antibiotic stewardship should be a priority in this setting. And why create specific guidelines for nursing homes? It's the second question. So we have guidelines saying that we should have guidelines that are adapted to the context as much as possible, even develop facility-specific guidelines. And the advantages of having these types of guidelines is to do a better choice of empirical treatment, choose narrower, do earlier IV to oral switch, have shorter treatment durations, fewer adverse effects, and all these according to meta-analysis with no impact on the cure rates. So in Switzerland, as you know very well, there are the SSI guidelines that are focusing to the community doctors, but as Domenica showed before, we have a lot of specificities in this population. So in our canton, the average age is 88 years old. We have atypical presentations of infections. We have residents that use catheters. or have chronic wounds. And as you saw, these were elements that will favor antibiotic use, and we also do not have GPs on site. Usually the decisions are made by telephone. We have no access, no easy access to laboratory and radiology, and usually the nursing staff is in the first line for these residents. And also other considerations. For example, we have administration constraints. It's not easily to administer an antibiotic IV in a nursing home. We have staff shortages, costs that need to take into consideration that might limit some treatment choices, and of course the resident preferences, quality of life that needs to be taken into consideration. So in general, we need to have guidelines that are adapted to this very particular context. And then I will present you the process of guideline development. First of all, to say that these guidelines have existed in the canton of Vaud since 2013, created by the unit where I work. And we had a current version in an update in 2018. And these have been used from several French-speaking cantons. There was also a German translation, and they were also available online. But after the pandemic, it was clear that a lot of treatment recommendations in this guideline needed to be changed because they were not up to date. So we thought that a new update was necessary, and we wanted to include in the process of the update as much cantons as possible. So this is how we worked. We had a leading group, so I had the coordination of the project, and a redaction group that needed to see all the existing evidence and make proposals for changes in the guidelines. And then we asked via the cantonal doctors all to propose people who were interested in the domain to participate. So we had the third validation group consisting mainly of ID physicians from its participating canton, nursing home physicians, and also nurses working in IPC in the cantonal level or within the nursing homes. We also had a palliative care physician which was involved, and overall 29 collaborators from 7 cantons, and the representation of the 3 linguistic regions. So I will give you then some examples of the updates that we did. So we have a first chapter which is a bit general, talking about infections in the elderly, and there we had previously all these geriatric syndromes that could mean infection, or that would push the GP to search for an infection. And we have now meta-analysis showing that there's no need to search for an infection for all these, just for the confusion. So we have retained only the confusion among these geriatric syndromes. And we also integrated a measure of urgency, integrating the Q-SOFA score. And for all the other types of infection, we mainly needed to shorten the duration of treatments. For example, for upper urinary tract infections, previously the guideline was 14 days, and we had to decrease that to 7 days. The presence of a urinary catheter was previously had a recommendation to receive longer treatment. Now, in the current guideline, we asked to treat the infection and not the presence of the catheter. So if it's an upper infection, it will be treated maximum 7 days. If it's a lower one, 3 to 5 days, depending on the molecule that we have. We introduced some proposals from prostatitis. And then we have, for bacterial pneumonia, a shorter duration of treatment, and the same for skin infections. We also have a chapter on vaccinations, and there we added the SARS-CoV-2 vaccination, the new zoster and pneumococcal vaccines that are reimbursed from insurance companies. And I will close with the dissemination. So within our canton, we distributed 3 to 5 paper guides in institutions, depending on their site. We have a lot of French-speaking cantons that are asking for them, so we have sent them. And we have translation in German and Italy, which is available in PDF format only for the moment. And we have created or updated our website, and you can find here the link. And it is now available for the moment only in French. So this was all about the update of the guidelines, and I would like to conclude with our activities regarding the World Antibiotic Awareness Week. We have developed a virtual escape game called Mission Antibiotics. It's the 3rd edition. Every year we have a new theme, and this year's theme will be the optimal duration of treatments, and there you have clinical scenarios for adult and pediatric medicine, with some clinical scenarios also touching the elderly and nursing home residents. So you can check that. It's available in our website. You can find it here. And to close the presentation, I would like to thank all the persons who participate. Some of them are in the room, who participated in the update of the guidelines and the development of Mission Antibiotics. Thank you.